Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Hemolytic anemia, and we're looking at its classification. So, first, it can be classified into two ways. First is based on the type of effect. So, let's look at the type of effect. So, when you look at the type of effect, it can be hereditary. So, it may be hereditary. So, it is hereditary. So, by hereditary, there are two things, that is intracorpuscular defects and the extracorpuscular factors. So under the intracorpuscular, so under hereditary, the intracorpuscular defects, so we're writing it as ICD. This includes the hemoglobinopathies. So it is the globulopathies. Then comes the enzymopathies. Next is the membrane cytoskeletal defects. So they may be the membrane cytoskeletal disease. So there can be hemoglobinopathies, there's enzymopathies, and the membrane cytoskeletal defects. So next, under hereditary, what is the extracorpuscular factors? So here, when you look at the extracorpuscular factors, we are writing it as easier. Extracorpuscular factors, it is the familial. So when you talk about the familial, it is nothing but the atypical. So it's atypical hemolytic uremic syndrome. Hemolytic uremic syndrome. Next is we move on to the acquired variety or the acquired type. So what is special about the acquired variety or the acquired type? So here the acquired variety, the intercorpuscular defects. So we are writing it as ICD, intercorpuscular defects. So here it is a paroxysmal nocturnal hemoglobinuria. So it is a PNH. So paroxysmal nocturnal hemoglobinuria. Next is the extracorpuscular factors. So this will include the mechanical destruction. So it can be due to the mechanically destructing. So mechanical destructions, that is a microangiopathic. There is a micro, M for microangiopathic. That is a destruction. Then is the toxic agents. Then comes the toxic agents. Then comes the presence of the drugs, then the infections, as well as the autoimmune. The second way of classifying it will be the site of the hemolysis. So based on the site of hemolysis. We are dividing it into the intravascular hemolysis as well as the extravascular hemolysis, and then a category where we are classifying both together. So when you look at the intravascular. So in the intravascular hemolysis, it may be due to the mechanical injury. So when you look at mechanical injury, it may be due to the trauma. So the trauma is caused by the cardiac valves. So trauma may be caused by the cardiac valves. And then there's a microangiopathic hemolytic anemias. Also the microangiopathic hemolytic anemias. So there's microangiopathic hemolytic anemias, that is it includes a hemolytic uremic syndrome. The hemolytic uremic syndrome, we're writing it as HUS, and the disseminated intravascular coagulation, DIC, then the thrombocytopenic purpura, that is a TTP. Next, they can also be due to the repeated physical trauma, PT, whereas the physical trauma. All this comes under the mechanical injury, and this is under the intravascular hemolysis. The next will be the complement fixation. In terms of the complement fixation, so complement fixation is nothing but the antibody mediated destruction. So it is antibody mediated destruction. So what is present under this complement fixation? There can be the hemolytic diseases. So it may be due to the hemolytic diseases, and they are present in the newborn. And then it may be due to the transfusion reactions. So transfusion reactions, as well as it may be drug induced. So these are the complement fixation. So it will be drug induced. Next we look at the infections of the red blood cells. So infection of the RBCs, that is the red blood cells. So infection of the red blood cells and may include the malaria as well as the babesiosis. So malaria as well as the babesiosis. Now let's look at the exogenous toxic factors. Exogenous toxic. So what is present in the exogenous toxic factors? So exogenous toxic factors, it includes the Clostridial sepsis. So this presence of the Clostridial sepsis. Then we move on to the extravascular hemolysis. So extravascular hemolysis. So under the extravascular hemolysis, the causes it includes the hereditary spherocytosis. So there is a hereditary spherocytosis. Then comes the presence of the thalassemia. Then is the sickle cell anemia. We're writing it as SCA. Now let's look at the intravascular as well as the extravascular hemolysis. The intravascular as well as the extravascular. So intravascular as well as the extravascular hemolysis, it includes the G6PD deficiency as well as the presence of the autoimmune hemolytic anemia. To learn and grow daily like this, please do subscribe.